Today's topic for discussion is protection of rights of women and children living with HIV/AIDS under the international laws. To introduce the discussion, human rights are broadly concerned with defining the relationship between individuals and state. In the context of international human rights law, it provides a consensual guidelines to as how the governments are ought to act in certain manner. The role of international law, as provided by the United Nations Organization, is crucial in discussing the relationship between the philosophy of rights and responses of the state. The discussion becomes even more critical when one discusses the guidelines of international laws on how to combat one of the biggest challenges that the mankind has ever faced. The challenge is none other than the one posed by HIV/AIDS, which stands to mean human immunodeficiency virus and acquired immunodeficiency syndrome. The idea of seriously responding to HIV/AIDS is directly linked to the menace it has caused to human civilization as a whole. Societies, families, and individuals affected by HIV/AIDS faces enormous deprivation of right to life, dignity, equality, shelter, food, healthcare, basic education, etc. Let us examine the facts of HIV/AIDS and why is HIV/AIDS an epidemic for women and children. According to the World Health Organization data of 2013, the number of people living with HIV/AIDS is 35 million, which is evident of a significant increase from 29.9 million in 2001. It is estimated that more than 16 million children under the age of 18 years have been orphaned by AIDS. At the end of 2012, it was estimated that 52% of people living with HIV and AIDS in low and middle income countries are women. Every 1 minute, a young woman becomes infected with HIV, with Sub-Saharan Africa reporting the percentage of young women aged between 15 to 24 years living with HIV being twice that of young men. 38% of adults living with HIV/AIDS in India are women. In the words of Michelle Sidebe, Executive Director of UNAIDS, I quote, "This epidemic unfortunately remains an epidemic of women." According to UNAIDS findings, in 2012, 61% of countries reported the existence of anti-discrimination laws that protect people living with HIV. The proportion of countries reporting the existence of HIV-related legal services increased from 45% in 2008 to 55% in 2012. But the lack of accessible legal services means that many instances of HIV-related discrimination are never addressed. Of the almost 50 countries reporting data on the prevalence of intimate partner violence, between 9% and 60% of women age group in between 15 to 49 years reported having experienced violence at the hands of an intimate partner. Two recent studies of women in Uganda and South Africa found that women who had experienced intimate partner violence were 50% more likely to have acquired HIV than women who had not experienced violence. Factually speaking, in Sub-Saharan Africa, 60% of people living with HIV are women. In Asia, 35% are women, and in Latin America, 30% are women. On the other hand, mother-to-child transmission also popularly known as MTCT, is an issue that directly affects women and at the same time increases the spread of HIV. UNAIDS say that at the end of 2011, there were an estimated 3.3 million children under the age of 15 years living with HIV, most of whom were infected by their mothers. Unless a proper medical security is provided, majority of children will not live to adulthood. Now let's examine some of the important hardships confronted by people living with HIV/AIDS, particularly in the context of women and children. They are emotionally unstable, socially stigmatized, economically and politically disenfranchised, educationally deprived, prone to commercial sex, denied of access to basic education and special medical care, and they remain malnourished and prone to multiple diseases. It is interesting to examine the initiatives of UNO, an international legal paradigm of tackling HIV/AIDS issue. The onus lies with the UN and the members to ensure a safer and conducive policy environment to protect women and children from a long-term HIV/AIDS hazard. The first case of AIDS was reported in the early 1980s. Since then, the world continued to struggle to eradicate the impact of HIV/AIDS. In this regard, UN's commitment is rooted in the crucial commitments set in the Universal Declaration of Human Rights 1948. Similarly, ICESCR prohibits discrimination in access to health care and underlying determinants of health, as well as to means and entitlements for their procurement on the grounds of race, color, sex, language, religion, political or other opinion, national or social origin, property, birth, physical or mental disability, and health status, including HIV/AIDS. To talk about international norms and initiatives on protecting the rights of women with HIV/AIDS. As a part of UN's initiatives, the Commission on the Status of Women has repeatedly expressed its concern over the growth rates of sexually transmitted infections and HIV/AIDS. The United Nations Commission on the Status of Women, also known as CSW, took up the issue of HIV/AIDS when it reviewed the critical areas of concern known as Women and Health at its 43rd session held in March 1999. It also discussed women and HIV/AIDS in the follow-up to the 4th World Conference on Women. The importance of HIV/AIDS question has been discussed on several occasions at the international level, and it is now recognized as related to development and safety issues. In January 2000, an unprecedented United Nations Security Council session was devoted exclusively to the impact of HIV/AIDS on peace and security in Africa. The special session of the General Assembly on Women 2000, Gender Equality, Development and Peace for the 21st Century, called on governments and other actors to enhance international cooperation in fighting HIV/AIDS and take bold measures to develop vaccines, low-cost diagnosis, adequate housing and social protection, and to assist girls and boys orphaned by AIDS and provide gender-sensitive support system for affected persons. Having understood the wider impact of HIV/AIDS, the UN has proactively plunged into initiating measures for fighting AIDS. The first international consultation on AIDS and human rights was organized by the United Nations Center for Human Rights in cooperation with the World Health Organization in Geneva from 26 to 28 July 1989. In consonance with the growing concern, the United Nations Center for Human Rights and the Joint United Nations Programme on HIV/AIDS, also known as UNAIDS, convened the second international consultation on HIV/AIDS and human rights in Geneva from 23rd to 25th September 1996. The UN's role in containing HIV/AIDS has been phenomenal. All people have the right to the enjoyment of the highest attainable standard of physical and mental health. The International Covenant on Economic, Social and Cultural Rights 1966, also known as ICE-SCR, provides that the states party to the covenant take steps to achieve the full realization of this right, including prevention, treatment and control of epidemic, endemic and occupational and other diseases. In 2003 and 2004, the Commission on Human Rights passed resolutions recognizing that access to HIV treatment is fundamental to progressively achieving the right to health and called on governments and international bodies to take specific steps to enable such access. Again in 2011, representatives from United Nations member states met to discuss global progress on the HIV and AIDS response, looking forward to an eventual end of the HIV epidemic. This was in line with the 6th Millennium Development Goal, which was to combat HIV/AIDS, malaria, and other diseases. With this in mind, the 2011 Political Declaration on HIV/AIDS set down a list of 10 targets with goals to be met by 2015. The 10 targets include reduction of transmission of HIV and eradication of HIV completely. However, the global fight towards ensuring the rights of women with HIV is still a dream to be fully cherished. In the context of the rights of children with HIV/AIDS and to examine the international response, one can argue that in its 17th session of 1998, the Committee on the Rights of the Child held a day of general discussion on the theme of HIV/AIDS and children's rights, in which it recommended a number of actions be taken, including facilitating the engagement of state parties on HIV/AIDS issues in relation to the rights of the child. The Committee on Economic, Social and Cultural Rights, which monitors the Covenant in 2000, made clear that the right to health included inter alia access to treatment and to HIV-related education. Similarly, HIV/AIDS has been discussed annually by the Commission on Human Rights for over a decade. UNAIDS and UNICEF have emphasized the rights of the child in relation to HIV/AIDS in all aspects of their work, and The World AIDS Campaign for 1997 focused on children living in a world with AIDS. And for 1998, the theme was on Force for Change, World AIDS Campaign with young people. At the international level, HIV/AIDS related rights have been recognized in the UN General Assembly Special Session, Declaration of Commitment on HIV/AIDS, a World Fit for Children of the UN General Assembly Special Session on Children, and in other international and regional documents. The Committee on the Rights of the Child, 32nd session held in January 2003, in its General Comment number 3, 2003, thoroughly discussed about the rights of children with HIV/AIDS in the context of the Convention on the Rights of Child, which came into force on 2nd September 1990. Several aspects of the rights of children with HIV/AIDS are explicated in the principles of the Convention. For instance, the right to non-discrimination, as said in Article 2, the rights of the child to have his or her interests to be primary consideration, as said in Article 3, the right to life, survival and development, as mentioned in Article 6, and the rights to have his or her views respected, as implicated in Article 12, should therefore be the guiding themes in the consideration of HIV/AIDS at all levels of prevention, treatment, care, and support. The issue of children and HIV/AIDS is perceived as mainly a medical or health problem, although in reality it involves a much wider range of issues. In this regard, the right to health, as mentioned in Article 24, is, however, central. The Convention on Rights of Children and its comprehensive approach provide a powerful framework for efforts to reduce the negative impact of the pandemic on the lives of children. The holistic rights-based approach required to implement the Convention is the optimal tool to address the broader range of issues that relate to prevention, treatment, and care efforts. Let us now examine what are the possible strategies to reduce the burden of the epidemic among women and their children, which include the following: ensuring sufficient resource mobilization, effective implementation of gender and child rights, increasing awareness and education, fight gender discriminatory practices, ensure safer sexual practices, and develop fast-track initiatives to prevent MTCT of HIV/AIDS. Towards the conclusion, one can argue that one of the primary obstacles to women and children living with HIV/AIDS is the deprivation from basic entitlements such as the right to inheritance and property. Unscientific and customary belief systems worsen the situation of women with HIV/AIDS, such as in terms of their employability, choice of marriage, right to childbirth, social respect, decision-making, political participation and representation, etc. Last but not the least, there is a clear need for changing our perceptions about people living with HIV/AIDS, particularly in the context of women and children. Therefore, the world has to stop perceiving women and children as a carrier and agency of HIV/AIDS.